the medicine you're using to lower your blood cholesterol the cause of your muscle, joint, and nerve pain? In this video, you will know about it. But if you need statins to prevent heart attack and stroke caused by elevated blood cholesterol, what can you do to protect yourself? In this video, I will teach you 3 ways to protect yourself from the adverse effects of this medication. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. Statins are the cholesterol-lowering drugs that your doctor have given you, including atorvastatin and simvastatin, are really helpful for millions of people who have elevated blood cholesterol. This is very important because this protects you from having heart attack and stroke. However, although these are effective in preventing such conditions, they have hidden surprising side effects. Look at this study here. The most common complaint and side effect of statins are actually due to muscle pain. It can also include weakness, wherein the person or the patient experiences weakness of different muscle groups, and even fatigue, wherein one complains that he or she easily tires. Now, these side effects vary from patient to patient. For others, it can be minimal, but for others, it can also be debilitating. In fact, it can affect one's quality of life. And in rare cases, these can lead to rhabdomyolysis or the severe form of muscle damage, which can also lead to kidney failure. Now, what's wrong here? And most importantly, how can you protect yourself from these side effects? But before we go into that, I want you to check, is there muscle weakness that you might be ignoring after taking statins? Try to observe. Because as mentioned, the most common side effects of taking cholesterol-lowering medications is muscle pain. These can be attributed to the fact that statin use can actually deplete your body from coenzyme Q10. Coenzyme Q10 is a compound that our body produces, and it is needed for the energy of our muscles. With the decline in the level of coenzyme Q10, one can experience different symptoms associated to your muscles. Joint pain and morning stiffness. Try to evaluate. Have you experienced joint stiffness or joint pain after taking your statins? Well, you're not alone, because this is also a common complaint, and usually this is just taken for granted. And these symptoms can actually mimic arthritis. So I want you to observe. If this continues, please have an X-ray of your affected joint. These can already confirm osteoarthritis. This way, treatment would be more specific for you. Nerve pain. This is surprising for many because not everybody knows that the use of statin can actually induce neuropathy. This can be attributed to the fact, as stated as well by the American Neurology Association, that statins can actually affect your myelin sheath or the covering of your nerves. The same study also found out that statin-induced neuropathy may continue months or years even after a patient stops using this medication. Now, here are the 3 things that you need to do to avoid these side effects. Talk to your doctor whenever you feel these symptoms, and if you think that these symptoms had been associated with your intake of the medication. it might be possible that your dose can be lowered, because look at this. Even the US FDA suggested that the lowest possible dose be given so long as the benefits of therapy is not jeopardized. Smart supplementation. Do you know that supplementing coenzyme Q10 can help protect you from the adverse side effects caused by statins? 100 to 200 milligrams of coenzyme Q10 can help prevent these side effects and can help you to be pain-free while protecting your heart health. If you have nerve symptoms, supplementation of vitamin B complex would also be helpful, especially vitamin B12, because this is responsible for our myelin sheath or the covering of your nerves. And in fact, depleted vitamin B12 levels in the body, nerve healing won't be possible. Omega-3 fatty acids. These will help lower bad cholesterol. And lastly, get to the root cause of the problem. The good news with elevated blood cholesterol, you can do something about it through exercise and diet. With exercise, you need to do 30 to 40 minutes of exercise 4 to 5 times a week. Avoid and limit your intake of processed food. Control your carbohydrates and sugar intake. And also, please take note that you are using the correct cooking oil at home. Avoid using vegetable and seed oil because it can further increase cholesterol level and promote inflammation in your body. The use of statins is very important, but these side effects should never be neglected. Being informed with these symptoms would help you make better health choices. If you want to know about the best types of oil that you can use at home to lower your blood cholesterol, we have a video here. Check on it. It will greatly help you. If you have reached the end of this video, please comment fit in the comment section below. Thank you very much for watching. I will see you on our next video.